want to learn, that's methodology. So it's like the third section is like learning cooking. How many of you love cooking? If you don't, then let's have the gender roles also. It's balance the gender roles, because once you start learning cooking, you will naturally come to write the methodology in a very orderly way. If you look at any paper, I think we've got a lot of handouts in the practical section we have in the handouts. You could see that the third section forms the bulk of a paper. Isn't it so? Most of the time, probably 2/3 of the paper or 1/3 of the paper is taken up on this third section, and therefore it is one of the most important parts. And I also like to thank for sharing this PowerPoint with me, so that it made my job easier, that it just spice up the presentation. So another thing is, if you go to a well-written method section, how does it help you? It helps you to know whether how feasible it is for you to reproduce the study. That's the common questions there based on that. Like, what is the relevance of this chikungunya study once more in this setting? It might be relevant because the setting might differ. Maybe it is in Tamil Nadu, the first chikungunya epidemic was. The strain might be different. You could say that this is in Kerala, and therefore the clinical features show subtle differences, so I would want to. So that is there. That will provide sufficient information. If you curate the methods well, that also gives you sufficient information to the prospective author as to whether this can be reproduced. And the third point is, if you write the method section properly, then it tells you whether the results are going to be accurate or not. So in a paper with a well-written method section, you can almost believe what the author is claiming that he has found. So basically, it is like the highlights of the methodology should be, you should try to write the method section clear and concise, and so that would help the others to replicate the study, as well as you have to present valid results and conclusions. Now I said that it's like learning cooking. So if you know cooking, you know that what are the ingredients to be used, and what is the order in which the ingredients should be added, and where do we have to spice up a bit. So this is the components of the method section. There are 6 mosquitoes there. They are, could you just tell me, repeat what is there in the PowerPoint? What would be the first mosquito, the first point in a research paper which you've gone through? What? Probably what? What is this study about? So you should tell, of course, in the introduction you would make a mention on what you are planning to do, and then you go over to the objectives. So that is the most important. Your objectives should be clear, and the study method is based on the objective. And then you go on to say what is the study designed to, because objectives will tell you what study design you're going to choose. And then you would say, like, who is who? None other than the patients or the subjects or the cases you're going to select. And then you would say where you're going to do the study, and that is the setting or the place where you're going to do the study. It could be in the field, it could be in your wards, it could be in your OPs. And then when? What does that show? The time frame of the study. Is it going to be a single examination? Is it going to be a 6 months duration, or is your data collection going to take 1 month, 1 year or so? And then you would say how. So that is where this topic comes in. How is the methods, or how you are going to collect the information. And So, these are the major components of a method section. If you look at it. Yes. Remember, in some papers you would see that there is some problem with the method section. That's because most of the time the investigator is not clear about his objectives. So he is totally confused as to how to go about it. Okay. Now I'll just start with an illustrated version of starting with the methodology. Let's say that this is an illustrated example. Let's say that I feel, because I'm an investigator, let's consider that I feel that the depression is on the rise among elderly population. In, let's say, my city, I've talked to so many elderly and found they are all depressed. And I particularly feel that many of the old age persons in old age homes are probably depressed. And I search for the literature. I think I'm interested to do that. And I search the literature and find, maybe in the West, where there are a lot of community care centers, this is true. So I would like to replicate my study. So my research question would be, anybody from this group? My research question would be, is depression common among citizens, old age citizens in Kozhikode Corporate? So Varsha's favorite topic, isn't it? So next is I would like to study the factors contributing to depression among old age citizens. So this is how now my objectives are precise, and I would like to write my methods based on these objectives. Organizing the method section. How do I organize in my paper? There are 4 things. If you look at a good written paper, the author will start with the study design, then he goes on to write about the selection criteria, how he selected these patients, how did he get the data regarding these, and also what has he done for the data analysis part. So, the first part, let's consider the first component of study design. I'm not going to go in depth into the study design because that's not curiosity, it's not a research methodology workshop, as Dr. Vinod pointed out. But I think let's have, so today we just focus on the types of studies. Basically, broadly we can divide the studies we do into descriptive studies, analytical observational studies, and analytical intervention studies. So from an epidemiologist or a public health expert or a clinician or a psychiatrist who is interested in something to do with field, problems in the field, basically all of us would like to do a descriptive study. Like a cross-sectional survey, a longitudinal survey, or a qualitative survey. Now, if you are a practicing clinician, you would concentrate on doing a case series study based on the patients who are reporting to your clinic. Then comes the analytical observational study. So you can see in some methods written as case-controlled study designs and cohort study designs. What you do here is there will be 2 groups. One with an exposure and one without an exposure. So those are, you just observe those 2 groups. You do not do anything on those groups as an investigator. You just observe what is happening to those groups. And that is analytical observation study. Whereas in the intervention study, as Dr. Vinod was talking about randomized controlled trials, the analytical intervention studies include randomized controlled trials, field trials, and community trials. So I hope this is clear in a nutshell. Now somebody asked, like, how do we, many of you may doubt, how do we choose our study designs right to the method? That is based on the type of research question. So a quick review into that. If you want to find out the burden of illness, that is, let's say, the prevalence of depression in the illustrated example I showed, you could go into doing a cross-sectional survey and a longitudinal survey. And if you want to find out the risk factors for coronary heart disease, you could very well do a case control or a cohort study. If you want to find out whether cancer is common among dye workers, the industry, the dyeing industry, you could go in for a ecological study. And if you want to find out, as in the paper which we have, two interventions, the effect of two interventions, that is two drugs, which one is better than the other, then you could go in for an RC. Again, if you want to do comparison of two diagnostic test evaluation or two surgical procedures, you could do a paired comparative study. And finally, if you want to find out the cost effectiveness of two treatment regimes, you want to compare, then you could do RC. So, using this, we could actually decide on what is the type of study design and also run it in your methods. Coming to participant selection. So let's say, coming back to my example, where do I get those old age persons from? Selection of participants. Any idea? The group? I should get the participants from? Easily from the old age groups. So that is the setting. Again, I've selected the setting, it is the old age home. And then I go on to write in my paper, what is the duration of the study? Just me, I've done the study, or I've collected the data from this period to this period. Okay. And then comes the selection criteria of the participants. How did I select? So again, then comes the sampling method. I think there was a question asked on how many numbers we need to take. Again, that is a preview of the statistical exercise class. But let's say that based on previous studies, I would come to know that this is the number of participants I would require for the present study. So the method of selection of participants and the recruitment process. So a well-written method section will have a mention on all these. The selection of the participants, the setting, the time frame, how did you select the participants, how many number of participants you selected, and how you have recruited them. Now, going on. Again, the paper will also have something called the inclusion and the exclusion criteria. So I'll give that, and also it will have a mention on target population and the accessible population in the study, which I'll be actually giving you an example. And for human subjects, your paper should include the general demographic and clinical characteristics of the subjects. If you're doing animal experiments, species, weight, strain, sex, age, and special characteristics. How will you select the participants? Write in your methods how the subjects were identified and how to get targeted. For example, how will you select the participants? Was it through consecutive sampling or different types of sampling methods? How did you recruit them? Okay, what was the process? Was it through a camp approach? Was it from your OPD? Did you go out to the field? Did you visit the houses? How many times did you go to the house to get that person? And that will also bring in, you have to write in your paper that you have visited the house 3 times, the house was locked, and therefore you didn't consider that house in the sample. Okay. So the method is implemented to reduce the refusal rate. What did you do to reduce the refusal rate? So the next house was taken. That's what I would have done. So this should be described. Okay, let's get it illustrated. In the depression example, what would be the study design? Cross-section, being a field study. Okay, and I think probably in Dr. Vinod Ravi's paper, this was a consecutive sample of chikungunya arthritis patient taken. So that was from the OPD setting. Is that right? From the OPD setting. And how did I select the subjects? Now let's look at that carefully. Writing the methods. How did I select the old age persons? So it's like I write in my paper that after having decided upon the subjects, I made a list of all the institutions where the old age were hosted in Calicut Corporation. Out of that list, by using a particular sampling technique, I selected few old age codes. But before that, I should know how many numbers of old age persons I need to study. So if the prevalence of depression is more among old age, I would need lesser numbers to be studied. Again, I think you have made the point. If the prevalence of a disease is less, that means I have to take a huge sample to bring out my hypothesis. So that's it. So by sampling using the appropriate sample size formula, which I think we could discuss during the practical sessions a bit, let me consider that I've written my methods. And the inclusion criteria would be all old age persons over 60 years who are living in the selected old age homes. And those who are willing for the study, some of them may be totally morbid, and therefore I will leave them out. This is the exclusion criteria. And inmates who were recently enrolled. Because if I take those inmates who were recently enrolled, I wouldn't be able to actually find out whether it is their stay at the old age home itself that is contributing to the depression. So that should be clearly written in your paper. Okay, let's go a bit more. Now, many of you might do different kinds of studies. Some of you may do comparative studies. For example, in comparative studies, you have two groups to compare. So how do you classify the groups or differentiate the groups? This is based on group allocation or participation selection that aims to improve the comparability. Or else what will happen is there will be a lot of bias in your study. So you should use technique that allows comparability. Okay. Now let us come to experimental studies. I think we'll be having a lot of discussion on this in our paper, the dummy paper. In that you will see that procedures like randomization, random allocation, blocking and concealment has been done, and we will be discussing that too during the practical session. Now let's go to observation studies. We talked about observation studies, isn't it? Analytical observation studies, which are case control and common. In that case, when you are writing, you have to write that in order to prevent bias in these cases and control, you have done matching between the cases and controls. So that is one technique. In longitudinal studies, now what we do is, suppose you are doing a study which is going over a long period of time. In that case, we need to describe in your methods the completeness and the quality of the participants, how many participants were there to the end of the study, how many of them dropped out, how many of them came in. So, a mention of all this should be clearly written in the method. Now let's go to data collection process. What do you need to write in the data collection part? We need to say how the data was collected, what were the variables measured for data collection. So what do you mean by variables? Variables are the general information which we collect and specific information too. All the clinical findings could be variables. Okay, so the general information could be age, sex, religion, and specific measurements could be BMI, height, weight, etc. Now comes, what are the methods we use to generate this data? That would also include, our paper also would include what are the instruments we use to find out this data. Remember, a well-written paper will use validated tools or instruments to elicit data. Now, what is validated? And what is the tool and what is the instrument? A questionnaire which you use to elicit data is a tool. A weekly apparatus which you use to measure blood pressure could be a validated instrument. So that is how all the mention of all this should be there in your paper. What about data source? I'm coming to the example. The data sources, I'm coming back to depression among old age. Let's say I visited the old age home selected. I've done a face-to-face interview using a tool. What is the tool given here? Using a semi-structured questionnaire which is pilot tested on a small group and then felt, okay, it's fine, so I'm doing it on a large population. And my questionnaire would contain 2 parts or 2 or 3 parts. talking about primary objective and secondary objective. There will be two objectives, probably in most of the papers. So you should also mention how you selected the data for both the objectives. So it could be the first part of the paper could be socio-demographic information. The second part of the paper would be measurements of the health status like BMI, height, weight, etc. And the third would be, my focus is on measuring depression. So I've used here a validated time-tested tool for depression. So this is how you should go to the method GD15 questionnaire. Now, after measuring, I would also suggest in the method that these are the variables A, B, C, D, and E as measured. Okay. Let's say, for example, BMI, diabetes level, socioeconomic status, whether he's a drug addict or not, smoker, alcoholic, etc. All these are variables. Now, in the paper section, you would see something called an independent variable. So, independent variable is something which we are investigating, and dependent variable is the one which I want to find out, and that's depression. Okay, so each variable I will measuring in order to answer my question, which is the dependent variable. Now, method is, you have to reference, as I said, reference all the procedures, describe in detail about the new procedures, name the apparatus which you are using one, whether it is a validated one, and also the manufacturer, name, city, etc. And that's very important in medical and surgical disciplines. When you are using instruments, surgical techniques, newer diagnostic methods, etc. Okay, so I've collected all the data. Now, the next job is to be statistician. But then, remember, your job doesn't end there, because you have to see that the data has been collected perfectly, at least near perfect fashion. Sometimes you give the questionnaire to somebody else and the questionnaire will be incomplete, and therefore that things should be taken into consideration, those things. And therefore in the data analysis, in the method section, you need to mention that the data was cleaned up by you, okay, and the final pooled figures were entered into whatever software which you use, MS Excel or SPSS or Stata or whatever, and then the variables were tested out. Okay, and again a good paper would say what are the statistical methods which you are using to describe your results. So there are two kinds of statistical techniques. Descriptive statistics, which means mean, median, the common one, standard deviation, and the inferential statistics, which you already see. The independent t-test, the paired t-test, p-values, okay, all those are the inferential statistics. So you will make a mention of that in your method section also. This is what I've said, I've already discussed that. And finally, at the ending of the method section, you should also make a mention on the reliability and validity of the data collection methods. At each stage, what did you do to ensure the data, the authenticity of the data? And finally, a comment on the ethical considerations. But I think in some papers you could see that some authors start with mentioning the ethical considerations and then go on, but in some papers you could see that towards the end they make a mention that the institutional ethics committee, okay, was consulted, the paper was, and it was given a green signal. So, in a nutshell, understand that when you read a paper, the third section is the most important. If an investigator is honest and he has done it methodically, then that will reflect in the method section. And remember, if you are a good cook, if you know what are the ingredients and you added the ingredients in an orderly fashion, that will reflect in your paper. And not only that, that will reflect in the results too, because results will be crystal clear, precise. So, in paragraph 1 in the papers which you are planning to write, see to it that paragraph 1 includes details of the participant section, like what we discussed, the procedures for each primary and secondary objective. How did you collect the data? What are the instruments and tools used? Were they validated? Did all of them attend? How many dropout rates were there? Etc. etc. And the last paragraph, how did you analyze it? Okay, so in a nutshell, this is all about methods. Thank you for your kind listening.